Welcome to the latest Milton Keynes Council COVID-19 update. The number of cases is currently 190 per 100,000 people in Milton Keynes. The way the figure is produced has been changed slightly to reflect where people are staying rather than their GP address. That means people away from home, such as students, will now be counted where they are living at the time of the test. Our number continues to rise and is too high. That is a concern. I said earlier in the week that we are at a critical stage in tackling the second wave and getting the number down. Stay home unless you can't. Reduce mixing with other households as much as possible. Follow the guidance. Take care. Get the rate down. Today, our local public health experts have asked me to talk about what is known as long COVID. Thankfully, most people with COVID will only experience mild symptoms, but we now know that some people get very sick, especially vulnerable people and older people. That's why we are making all these sacrifices. However, there is another way in which COVID can affect people who have had it, even if their initial period of ill health has passed. This is called long COVID. Long COVID can affect anyone. It isn't limited to older people or how severe your initial symptoms are. Experts are still working to understand it in more detail, but what we do know is that it is linked to COVID-19 and can have a huge impact on those it does affect. You can be a healthy person in your 20s, 30s or 40s who only has a mild case of COVID-19 but get it hard by long COVID. Long COVID can mean months of extreme fatigue, breathlessness and persistent aches and pains. It can cause headaches. It is known that it can affect your brain, gut and heart. Several people report mental health problems and feeling depressed. Some people are unable to process their thoughts clearly. Long COVID seems to happen to about 1 in 20 people of all COVID-19 sufferers. That might mean, for most people, long COVID could be worse than the virus itself. There is currently no way in which I can advise you to avoid long COVID if you're infected with COVID-19. The only way we currently know is to avoid being affected with COVID-19. That means taking the basic precautions to limit the spread of the virus. Keep avoiding unnecessary contact. Stay at home. Follow hands, face and space. And isolate and get a test if you have symptoms. On a more positive note, this week we have reached 400 people signing up to be a COVID-19 Milton Keynes champion. Thank you, all of you. Our champions get an update by email each week with all the latest information that they can share with their friends, family and colleagues. They can also ask our public health team questions. If you'd like to become a champion, please drop us an email at covidchampions@milton-keynes.gov.uk. Until next time, thank you and goodbye.